Welcome to Podcast Nuggets. In a recent podcast, Gabor Maté dropped truth bombs on childhood trauma and mental health. From small T traumas to embracing authenticity, it's a game changer. Childhood shapes us, but awareness is key. Creativity is a must, and trauma healing is for everyone. Let's challenge norms and dream of a better world. Hit subscribe, tap that bell, and join the journey to a healthier, happier you. These are the best ideas from the Diary of a CEO podcast with Gabor Maté. Let's dive in. Childhood trauma can lead to physiological stress in children, impacting their health and development. Link between mental illness and childhood adversity is as strong as smoking and lung cancer, often overlooked in medical education. Trauma is about what happens inside us as a result of experiences, affecting physical and mental health. Early experiences, especially in the womb and early years, shape our worldview and sense of self. Infants feel and internalize stress from their parents, influencing their worldview and self-perception. Separation from mother in early life can create a sense of rejection and abandonment, impacting relationships later in life. Awareness is a crucial step in overcoming traumatic interpretations of oneself, understanding and challenging internalized beliefs. Traumatic experiences can manifest in workaholism and addictive behaviors as individuals seek external validation. Workaholism can be a way of trying to prove one's worth to the world, seeking external validation for internal emptiness. Working in palliative care teaches acceptance of one's lack of omnipotence and the importance of being with the inevitable. Facing terminal illness can lead to a re-evaluation of life, appreciation of every moment, and reconnection with authenticity. Following creative urges is essential. It's an intrinsic part of being human, and stifling creativity can lead to frustration and a sense of being hemmed in. Expressing creativity is essential for mental well-being. It can take various forms like art, social interaction, or athletic expression. Suppressing creative expression leads to suffering. Fear of not being good at it creates a trap. The act itself is the reward, not external validation. Identifying too closely with one's work can lead to anxiety and affect self-worth. Separating oneself from the outcome is crucial for a healthier creative process. Lack of self-worth can drive individuals to create for external approval. Yet separating one's self-worth from the outcome is liberating and empowering. The myth of normalcy is often harmful in societal terms. And what is considered normal may not be healthy or natural. It's a societal construct that can be detrimental. Rethinking the concept of normal in medicine. Diagnoses are not explanations. And understanding an individual's life context is crucial for effective treatment. Viewing diseases as processes rather than fixed entities allows for a more accurate understanding of health. Considering the impact of life experiences and stress. Trauma defined. Trauma is a psychological wound. An unhealed injury that behaves like a wound, causing pain upon triggering and leading to scar tissue, affecting emotional responses. Trauma is not only about major events. Even small events in childhood, like not having emotional needs met, can lead to lasting wounds. Big T traumas include severe events like abuse, but small t traumas, like not feeling unconditionally loved, also impact individuals. Trauma is more common than perceived. Unmet emotional needs in childhood contribute, affecting individuals in various walks of life. Trauma responses can differ. Two people experiencing similar traumatic events may develop contrasting behaviors as a result of their interpretations. Pathological lying can be a survival mechanism rooted in childhood trauma, where one learns to deny reality as a defense mechanism. Awareness is the crucial first step in addressing trauma. Recognizing patterns, behaviors, and the impact of past experiences is essential for healing. Various approaches, such as therapy, meditation, nature, bodywork, and even psychedelics, can aid in the awareness and healing process. Addiction is not limited to substances. Behaviors like work, social media, and food can become addictive when they offer temporary relief but cause long-term harm. Addiction is not limited to substances. It can be behavioral, for example, workaholism. The brain chemicals sought after are often the same, such as dopamine. Escapism may not fully capture addiction. It's often a search for relief from distress or a lack of a sense of worth, linked to past traumas. Understanding the benefit of an addiction is crucial. Acknowledging what one is looking for is valid, but addressing the root cause of the lack of worth is essential. Authenticity is vital for healing. It's about being true to oneself. Shedding masks and embracing authenticity brings a sense of lightness and expansiveness. Agency is taking personal responsibility, not using trauma as an excuse. It involves making decisions about interpretations, reactions, and health choices. Alliteration aids in making ideas memorable. The 5 R's, relabel, reattribute, refocus, revalue, recreate help undo self-limiting beliefs by creating space and fostering awareness. ADHD isn't necessarily a genetic disease. While sensitivity may be inherited, genes alone don't determine conditions. Sensitivity makes one more prone to environmental stressors. Financial stress on parents can lead to physiological stress in children, potentially contributing to ADHD diagnoses. A study of 65,000 children and parents suggests a correlation between parental trauma and the likelihood of a child having ADHD. There is a higher likelihood of diagnosing ADHD in poor kids and kids of color, possibly due to increased stress factors. Early medication for ADHD might help symptoms in the short term but doesn't address the underlying developmental issues caused by stress. Positive changes in the home environment. Understanding the child's sensitive nature and addressing parental stress can lead to significant improvements in ADHD. While medication can be helpful, addressing traumas and stresses is crucial for long-term development and well-being. Society's toxic aspects are evidenced by rising rates of medication use, chronic illness, depression, and environmental issues, indicating a need for awareness and change. Raising awareness about trauma's impact on mental and physical health in healthcare, education, and society is crucial for positive change. Parental understanding of the first 3 years' crucial role in fulfilling children's needs can significantly impact the child's development and future well-being. Schools should prioritize promoting healthy brain development by creating safe, nurturing environments, understanding that the most critical role isn't just imparting information but facilitating curiosity and mastery. Awareness of the cost of smartphone addiction includes the impact on meaningful connections and interpersonal relationships. Gabor Maté reflects on the concept of selfish dreams and acknowledges that his dreams are more focused on a better world for future generations. Maté's dreams are about creating a better world, reducing suffering for children in conflict zones, emphasizing the interconnectedness of selfless and selfish aspects. The aspiration for a better world involves relieving suffering globally, including regions like Gaza, Israel, Ukraine, and Russia, highlighting the desire for a world without poverty and conflict. Gabor Maté expresses that working towards a better world not only benefits others but also brings personal fulfillment, emphasizing the interconnected nature of selfless and selfish motivations. For the full podcast, check out the link below.